Bring us in, Victor, by yourself. Welcome to Coco Caliente. Man, that just doesn't have the same punch and oomph that it used to without Nicole. Still here by myself. But actually, right now, as I'm recording this, I finally took a trip back home. So I'm in Louisiana. And I've been, I flew down here last Wednesday, right? No, I flew down here last Monday. So today I'm recording is Tuesday, right? So I got here over a week ago, surprised my mom. Things just kind of finally lined up to where I can come over here. Hence and therefore, last week's episode was with my mom because I got here and I recorded and she had no idea. So then we went to Destin. I spent time with my family over there. My sister and her kids all came up. There's a bunch of them, right? She has like 6 kids with her, Tito, her husband. And then we also had my cousin who drove 7 hours to come see us as well with his 2 kids and his wife, David and Giselle. And so it was awesome. It was a great time. I got super tan. But anyway, leading into this podcast, right? When I was over there talking to my cousin David, he was telling me, he was like, hey, I want to talk to you about something that, I think is important and somebody that I think you should have on your podcast. And, I hear that quite a bit, right? And so 9 times out of 10, I'll take it with a grain of salt, okay? Because everybody thinks everybody's interesting, and that's great, but I can only have so many people on the podcast, right? And then he started talking to me about this woman named Laura. Sorry, I got a frog in my throat. This woman named Laura Bray, right? And basically his son, David's son, I think he's like in middle school or something like that. He was going to school and he made a friend with this girl named Abby. And they became good friends. And then Abby got diagnosed with cancer, right? And now Laura, her mother, Abby's mother, she's in this world, as a parent with a child that has leukemia. And, going through the whole process, obviously, I can't even begin to fathom what that's like, right? But basically, at some point during this process, they find out that they need this medication, and there's a shortage of this medication, and they can't get it anywhere, right? So then Laura took it upon herself. She created this thing called, this organization called Angels for Change. And she'll explain it more on there, but basically, they're getting medicine to people that can't get it. Right. Not that it's just, it's out there. The medicine exists, right? But, and trust me, she'll explain it a whole lot better. But this medicine exists out there, but there's a shortage of supply. Only hospitals have it. They're not really selling it out to people. And her, with her group of Angels for Change, they're getting those medications out to people that need it. Right. So she started obviously with her daughter, and she saw that this was a need, and now she's doing it for everybody. So I hope you enjoy. Laura Bray, correct?
Yes.
Let me tell you, because I was just in my little intro here, I was kind of giving you the gist in the most short way possible of what David, my cousin, told me about you. But I will say, when he first brought you up, and I didn't know anything about anything, right? He just, hey, I got somebody that I think you should podcast with. I was like, oh, here we go, right? Because I podcast a lot, and, I get people all the time. It's like, hey, you should podcast with this person. And, the first, and you hear so many that I'm like, yeah, well, we'll get around to it. A little
skeptical.
Yeah,
right. Yeah.
Of course. And then he told me your story. And I was like, wow, that's really powerful, right? What you guys are doing is insane. And I was like, well,
it is insane.
And it just happened to be where, like, the guest that I was having for today, it fell through. And I was like, oh, what a perfect time. I just found out about this. I want to talk to her anyway. So this worked out perfect. And yeah, so here we are with Laura Bray, Angels of Change. Tell me about yourself a little bit. And yeah, I guess before any of this happened with Angels of Change, like, what were you doing? What was life like for you?
Yeah. So first, thanks for having me on, Victor.
Absolutely.
I should say this is my first podcast, so, feel free to help guide me.
No, you'll be fine.
Anything.
You'll be fine. Don't worry. It's all live, so if you mess up, everybody knows exactly how. No, I'm just kidding. This is pre-recorded. It's pre-recorded.
Oh, great.
Don't stress.
I had a mini heart attack when you just said that. I was like, oh, no.
No, you're good.
Yeah, so our life was pretty normal. I have 3 children, and my youngest is a boy, and I have two girls. And my husband and I, we have jobs, and we went about our lives doing the normal American dream stuff. Taking care of the house and getting the kids to school and going to jobs. I'm a business professor, and I love it. I teach at a community college. I really love my students. I think I get a wide range of students, anywhere from 18 right out of high school all the way to adults who are running their own business but going back to education, and I really enjoy the challenge. And that was basically our lives prior to Thanksgiving weekend of 2018.
Okay.
Just a normal family.
So what transpired on Thanksgiving of 18?
Yeah, so my middle daughter, Abby, she had just turned 9. She was in 3rd grade. She had been unwell for almost 4 weeks. She got this minor cold, and she really couldn't shake it. She would get these low-grade fevers, and it seemed to be accompanying pains. She kept saying there were daggers in her bones. And she's not, if you've ever met her, she's a force, a complete force. She's been a force since the day that she was born. So it was unusual for her to be acting this way.
Yeah.
But because she was 9 and, the doctors felt the daggers in the bones were growing pains.
Mm-hmm.
And, so we kept going back to the doctors every, 3 or 4 times in those, 3.5, 4 weeks.
Yeah.
And eventually, on Thanksgiving night, I had started saying, look, this is to my husband, this is not normal. These aren't growing pains. They seem to be linked to the fever. She'll get these pains, these episodes, and then within an hour she'll have 101 fever. It's like clockwork.
Yeah. And
on Thanksgiving night, we were actually on a cruise, so that's a whole nother part of the story.
Oh my gosh!
But I know.
How long into the cruise were you guys in?
So it was just a little 2-day Thanksgiving cruise with our family. Our whole family was there, and we had decided to spend Thanksgiving that year all together on a cruise.
Okay.
So, it wasn't a really long one. We were a day and a half into it, and we were going to be back by the Friday, the day after Thanksgiving.
Mm-hmm.
And everything was fine that day. She was fine, and we all went to shower and get ready after being at the pool to go to Thanksgiving dinner. And my brother had this huge, wonderful, special Thanksgiving dinner, planned for the whole family. It was just for us. And she's in the bathroom, and she just fell and started screaming in pain. And so I said to my husband, okay, I want you to put your phone on timer for 1 hour. And when it goes off, you're going to take her temperature, and it's going to be 100.1. And he looked at me like, okay, challenge accepted.
Yeah.
Because she was screaming in pain and she was crying. And so by the time the timer went off, she was fine. She wasn't screaming in pain. I had kind of, rubbed her and, helped her like, mom does.
So, and when you said she falls down in pain, what is she holding or what is she saying? If somebody else is experiencing something like this. So first it was in her side, like she was saying in her side. And the very first episode, I thought she was having an appendicitis. Oh, okay.
We went to the doctor and they did a finger prick and, they they checked her appendix and she was fine. So this one was her leg. And she had been saying her leg for about a week and a half.
Okay.
But this time it changed to the other leg. And I was like, a bruise or a muscle pull or a growing pain doesn't like go from like,
it doesn't float around the whole body. Yeah.
Right. And so, when that timer went off, we took her temperature and it was 101.1. And he was like, okay, we're going to the doctor's tomorrow. So we actually, the cruise didn't end until like 2, but we had docked. And like when we docked, we were packed and we went straight off the boat, straight to the pediatricians. And I just said something, they did the same thing that they had been doing, which is, strep test, flu, like listening to her heart. Everything's fine. She's fine.
Just a normal checkup procedure type stuff.
Right. And I just said, something systemic isn't right. I don't know what it is. I had actually said the word cancer 3 days before to my husband, but it sounded even crazy to me to say, right? She seems healthy to everyone else, but I just knew something wasn't right. And so I just said, will you please do a full set of labs? I want a complete blood panel. I need someone to look at her blood. We live in Florida. So I was like, she was a swimmer. She had just qualified for states in the backstroke for 9 and under. And with the Y League that she was part of. And so I thought, well, maybe, she swims a lot. Maybe she got a little scratch and she got some weird Florida bacteria. Like, I was like, I don't know, but something's not right.
Yeah.
We went home, and the next morning, so this is when our life changed. So this was the Saturday of Thanksgiving weekend, 2018. We were just in our jammies, like, probably every single person was. We were watching the Macy's Thanksgiving Day Parade that we had recorded because we were on the cruise on Thanksgiving Day. And it had always been our tradition to watch, in our pajamas, right, when we woke up. So we did that on the Saturday, and our cell phone rang, and it was literally 30 seconds of words that changed our lives forever and made us a new family. And the words were, there are blasts in Abby's blood. There is a bed waiting for her at St. Joe's Pediatric Oncology Unit. Pack a bag, plan to stay, get there immediately.
Oh my gosh, that just made my hair stand up.
It makes mine stand up too, every time I think about it.
Dang.
Yeah.
And
yeah.
Wow. I'm sorry to make you re-experience this, but I think it's an important conversation to have for other people, that are listening. So during this time of COVID that we live in now, there's a lot of time spent inside, and a lot of times that brings up a lot of emotions that we don't normally think about because we live a normal, busy life. And now anything is but normal, right? But don't worry, because there is BetterHelp out there. BetterHelp has licensed professional counselors who are specialized in depression, stress, anxiety, relationships, sleeping, grief, self-esteem. I mean, they have everything, right? And it's professional help. Right? This isn't like a self-help thing. It's professional counseling. You can send a message to your counselor anytime. You'll get timely and thoughtful responses. Plus, you can schedule weekly video or phone sessions, all without ever having to sit in an uncomfortable waiting room, which is perfect right now because nobody wants to get sick. BetterHelp is committed to facilitating great therapeutic matches, so they make it easy and free to change counselors if needed. It's more affordable than traditional offline counseling, and financial aid is available. It's convenient, professional, affordable. This is not a crisis hotline. In fact, so many people have been using BetterHelp that they are recruiting additional counselors in all 50 states. If you want to start living a happier life today, as a listener, you'll get 10% off your first month by visiting betterhelp.com/Coco. Join over 1 million people taking charge of their mental health. Again, that's BetterHelp, HELP.com/Coco. So you guys get to the hospital, and that's when they tell you guys that...
So, actually, no, it was... So we got to it was like 10 o'clock in the morning.
Uh-huh.
And they bring us right back and start doing all kinds of tests because, they don't want it to be cancer, right?
Okay.
They're trying to rule, there's blasts in her blood, which means, there's bad blood cells, which are not correct. So, I think they wanted to rule out every single thing that they could before they
it wasn't some type of infection that's causing this or something else that could be
something weird, some random weird once in a shot other thing that it could be. And so it was 5:30. Actually, at 3:30 was the first time we saw her physician. So we were there in the hospital, like people coming in, doing things. And, our job is to try to keep her as calm as possible.
Yeah, absolutely.
She's 9. She knew that she had not been well, right? And so we just told her, the doctor called and said they think they may know what's going on, but we need to do some more tests, so we need to go to the hospital and pack a bag. My older daughter, who had just turned 11, she wasn't buying that. She didn't understand why we were going to have to pack bags and why we weren't just coming back. But Abby, she was like, okay, because she knew she hadn't been feeling well. So at 3:30, we saw the doctor for the first time, and that's the first time. She was like, okay, we have some more tests that we're going to run. We should know something by 6. And that's when she said, if it's leukemia, we have to start something really quickly. Treatment begins immediately.
Yeah.
And you need to be prepared for that. And so we were like, okay, thank you.
Oh my gosh.
And of course, I don't know how much you know about cancer or leukemia. I mean, we really didn't know much.
Yeah, no, I don't know much at all. Educate me, please.
I mean, I didn't either. At that point, we didn't. We knew nothing. I mean, pediatric cancer, I knew that it was something you didn't want. Mm-hmm. I knew that the St. Jude's commercials that were on TV
Yep.
were devastating and very difficult to watch. That's the extent, to be honest, of my knowledge. I feel sad that was the extent of my knowledge and the amount that we've learned in less than 2 years. But I don't know. Did you have any?
No, I don't.
Any knowledge of cancer? Or?
No, I know a little bit, right? Your cells are attacking themselves, and the best treatment that they have out there a lot of times is the radiation, and just to kill the bad cells, hopefully faster than you can kill the good cells. And that's pretty much all that I know. I haven't done much research on it.
Yeah. Well, you're in good company because I didn't know much either. So leukemia is cancer of the blood. And so, at the time of diagnosis, she had 75% blasts, which means 75% of her blood was leukemic. Wow.
That's really high, right? I mean,
well, she was found, at the time, her labs, like the finger prick, this were normal. Her labs were completely normal. It happened so fast. So she has what's called acute lymphoblastic leukemia. And acute is that it happens really fast, really fast. And you can go from being, a child who, when, qualifies for state in the backstroke for the under 9 and under category, the first week of October, to having 75% of your blood cells be cancerous, in a couple of weeks.
Wow. That's so rapid, and that's scary. I mean, I just can't imagine what was going through your mind when you heard that. You know what I mean? Like you have to be strong because you can't, correct me if I'm wrong, but you have to do your best to keep her as calm as possible, because if you're freaking out, that's not going to help her,
That's right. I mean, my job is the caretaker, right?
Yeah, absolutely.
I've got to make sure she is in the best space, mentally, physically, spiritually, to fight this beast that's trying to take her over, right? So, but that's kind of your role as a parent always. It just drastically gets harder.
Yeah.
But yeah.
So
that was our Saturday, the Saturday after Thanksgiving.
So, things are somber, to say the least. But you then at some point you find out that it's actually that lymphoblastic leukemia?
Acute lymphoblastic leukemia.
Okay.
Yeah. ALL. We can call it ALL for short.
ALL. Okay. So now we confirm that she has ALL. Are you now like, all right, so what do we do? Right? Like the solution.
Heck yeah.
Where's the solution?
So,
how do we get there?
Yeah. You're right. That's exactly it. So the doctor calls us out of the room at about 5:30. Some interesting things. I don't know. I mean, we just met, so I don't know if you have any, faith. But our priest had come at 5, and so he actually, to just kind of see us and to do some. We did a prayer and
absolutely
a little prayer service, and he was there when the doctor came in at 5:30. So that was completely serendipitous. We had just done this wonderful, peaceful prayer, and then he was there when the doctor came and asked if she could see my husband and I outside of the house, outside of the room. Yeah. And so he was like, I got it. I'll stay here. And so she told us, Abby has acute lymphoblastic leukemia. She explained a little bit about it. We asked a couple of questions. One of the things she said is, okay, so here's the thing. 30 years ago, this was a completely different treatment, but there is this treatment for ALL. The research has changed drastically, and it's a long and arduous treatment, but it is extremely successful. We don't know exactly what treatment she's going to have and exactly how long until we do something called a bone marrow aspiration, where they go into her bone marrow and actually remove some bone marrow and then test it. We'll do that immediately. But there is a prognosis, and this is one of the few pediatric cancers that has a cure rate. So we're going to follow this. It's going to be long and hard, but there's this very specific protocol we'll follow. And it has a very amazing cure rate. So they pass on the assurances. So unlike other pediatric cancers, there's some pediatric cancers that they still in 2020 have 0 treatment options. None.
Oh, that's so sad. That's so sad.
And then there are many, many that have treatment options, but the rate is very low, very successful. But this one is one that is very successful. So we kind of, use those assurances to explain it to Abby. We walk into the room. I'll never forget some of these moments. There's moments that get like burned into your brain and your life. Yeah. We walk in, and our pastor is feeding Abby. At some point while we were gone, they had brought some food into her, and it was a quesadilla, but he had cut the quesadilla on a fork, and he was feeding her quesadilla while talking with her Ducky, who's her, her best friend. And like Ducky was like, "Does Ducky want quesadilla? Does Abby?" Oh my gosh, there was just this peace and like tranquility in this room that we walked into, and it really gave us the strength to tell her that she had cancer. But it was quite a unique moment. I'm thankful for it.
Could she comprehend what that was? Because she's so young.
Yeah. So I think one of the things that prepared her for comprehending, and I will always be grateful, it was a decision that we had made 2 or 3 years before. A very good friend of ours, and she had children that were the same age as my kids, and so my kids and her kids were close. Mm-hmm. She had been diagnosed with breast cancer, and during that time, her diagnosis and her treatment, we really leaned in to that.
Yeah.
We really wanted to be there. I was open and honest with the kids, like when they had questions, so they knew. She had an understanding of what cancer was. And because of my friend's journey, really understood what chemotherapy, as best as a 9-year-old could, understood what chemotherapy
absolutely.
was, understood that it was long, and also understood that you can be okay, right? Because of my friend's journey, who she, handled it with beautiful grace and kindness, and then she was fine. And, so Abby had some awareness of it. So when I said, what I said was, Abby, the doctors know what's wrong and they're going to be able to help us. She was like, for her first answer was good, because she had been in so much pain. And I said, you have leukemia. She didn't know what leukemia was. Mm-hmm. And she was like, what's that? And I said, well, it's cancer of your blood. And the first thing she said was like Miss Cozy. And I said, yes. Oh. So she had that. And that, I really feel, it was a interesting decision 3 years prior when, I had, a 2-year-old and a 6-year-old and an 8-year-old to have these open and honest conversations back then, the way that they could understand it. But
absolutely.
Back then,
yep.
But because we had it, and we had these discussions throughout my friend's journey, it actually made that evening a little bit easier for her, if that makes sense.
No, it's definitely one of those, you look back and you're like, man, everything happens for a reason, right? And so,
yep.
So you guys went through that other journey, and now you're going through your own journey. And so that's where you were at that point. But that's, and like you said, it helped that conversation a whole lot more than if it would have just been from the, you don't understand what this is, and now I got to go explain it all,
Yep.
We all know this school year will be unlike any other, thanks to COVID. Whether your kids are going back to school or logging into a classroom from home, and as parents, it can be time-consuming to give your kids the extra help they might need this school year. This company, KiwiCo, can deliver a science fair/art class right to your door. I was even surprised how much I liked it as an adult. Like, I was looking online, and they have these other kits that I think Nicole and I would love to do, like a pinch needle, a pinch thread needle or pinch needle, something like that. A pillow that you can make. Yeah, punch needle. That's what it is. A punch needle pillow. I was like, dang, Nicole would love to make a punch needle pillow. Me, not so much, but I think I would like the macrame planters. I don't know. And I had one that I got delivered to the house because I gave it to gift as my friend, and it's for babies, right? Because they have all ages, from like 0 to 14 and older. They have all these different crate sets that you can get, and it comes with a bunch of different projects, and for all types of kids, right? So it was really cool. Anyway, the one that I gave him was for his baby. And it was basically like putting pegs on a pegboard type deal. And it came with a bunch of other stuff, but he messaged me after and he's like, man, this thing is awesome. Your child can get super cool hands-on science, art, and geography projects delivered to their door every month. And they'll be so excited to see these arrive in the mail, especially at a time when they might be unable to go to fun places like museum. Here's a really fun activity that comes straight to them. You'll be surprised how high quality the materials are too. These are real engineering, science, and art projects for children. They're not just toys, right? They're learning something. They're doing something. And there are different crates for kids of all ages, so there's something for every kid on your list, all right? What's awesome, too, is that there's no commitment. So let's say you want to try it out for a month or two, and then you're like, this isn't for me. You can cancel anytime, but trust me, you're not going to want to cancel. KiwiCo is redefining learning with hands-on projects that build confidence, creativity, and critical thinking skills. There's something for every kid or kid at heart at KiwiCo. Get 30% off your first month plus free shipping on any crate line at kiwico.com/Coco. That's Kiwi, KIWICO, kiwico.com/Coco. And so they do the bone marrow, right? To actually figure out what the prognosis and the track is going to be, right, for the treatment. And then so
that happens immediately.
That happens immediately. And then what do they tell you from there about, okay, this is a treatment, but...
So the good news is that her even though she had 75% blasts, her genetics were okay, and it hadn't spread outside of the blood, and it wasn't in her spine that hadn't metastasized or anything like that. And so we had a lot of positives from that initial bone marrow aspiration, and so she got to be what was called standard risk. And standard risk is a track of about almost 2.5 years of chemotherapy, and it's very involved, but it has very, very good outcomes. And so they said, okay, great, this is the track, you're gonna do it, and they talk to you at that time, like, this protocol is really important, you've got to follow it. They talk about compliance. Okay. And that compliance is the biggest thing, which is tough. I don't know how much you know about getting kids to comply, but sometimes that's difficult. Absolutely. Right? And so you root the assurances to your children in the fact that you've got this protocol and that it works, just like the doctors do. But you also tell them, like, when they don't want to go into the hospital one more time, you and the doctors and the nurses are saying, it's really important, you got to take your medicine. When they don't want to take 25 pills in one dose, one, and you have to do it within a certain amount of time, and it has to happen every day, because who wants to take 25 pills?
I can't even imagine. Yeah.
Right. When their hair falls out, when they miss out on things, you're rooting all of the things and the importance of this protocol, right? And this timing. So I like to call this time frame from the end of November to the beginning of spring, to springtime. It's really, I used to joke and say I became the caretaker in chief, or the chief normalcy officer, Yeah. Pediatric cancer is a little bit different than some other cancers because it affects the whole family, right? Your child needs their siblings as much as they need their parents, right? And so the siblings, their lives change as well, and you've got to help them through that. And
and the more I think about it, and the more I hear you talk, like, I can take this conversation like 15 different routes to like how deep it can be, right? Like with the family bonds. And then when you're talking about all these treatments, I'm thinking like insurance and like pharmaceutical and corporate. And then, and then we're going to get to a point where it's like really pharmaceutical and like global supply and demand, like all that. This is a huge undertaking, right? Like once you get into there, and I'm happy that not everybody experiences it, because I don't wish that on anybody. But man, once you get into that world and you don't know that world, which you were learning, I mean, it can be overwhelming.
It can be overwhelming. And, just like any time when you're overwhelmed, you literally have to take it 1 second at a time sometimes,
Absolutely.
Otherwise you just get stuck. And so that's really the first few months, was just trying to help us navigate through that change. Every single thing that was normal changed. I mean, even little tiny things like, can my kids still share a room? My daughters have shared a room since they were babies. Can they still share a room? And scary things like, the truth of the matter about pediatric cancer is that you have to poison your child to save them. Yeah. But that poison is poison to your other children as well.
So, in what way? How does it transfer over? If I guess you could say,
through body fluids. My kids all shared the same bathroom, and when you've got vomiting, my kids are sharing the same room, and she gets sick, and that is literally radioactive scenarios. Wow. And they want to help their sibling, right? I mean, do you have brothers or sisters?
I have an older sister. Yep.
So like, especially an older sister, I'm sure there was a time in your life where you were throwing up and your sister like rubbed your back, right?
Absolutely.
Probably, right? Or
Yep.
she was like, here's some water, right? So those moments are as important to both my daughter who was fighting cancer, but my other children. They want to be able to support, but at the same time, we have to figure out how can they do that in a way that is safe.
Yes.
And the other scenario is how can we do it without creating all these anxieties in them, right? I mean, do you tell your 5-year-old, hey, you can't go near your sister because, right? I mean, so like you just have to navigate all of those things.
Wow.
There's so many of them that's
something that I didn't even think about. Right, like when you hear about that stuff, and like you see it in the commercials, right, for St. Jude's and stuff like that.
Yeah.
Like you just think about that child or that person, the individual, being in that situation, and it's very sad, and wish them the best. But you don't think about like what you just said, person in the house, they're throwing up, and then you're like, well, how do I help? How do I without being like, ew, I don't want to help you because I can get sick. And still wanting to. So that's I didn't even think about that, honestly.
Well, and there's so many things. All the medications that I'm giving her, I have to wear gloves for. And so you can't get away from the fact that you're poisoning your child to save them. It's just you have to come to terms with it.
No, go ahead.
Realization that I had was like, and you get lots of questions too. Like people are asking, well, will it stunt her growth? And will she have cancer later? And will she ever be able to have children? And I'm like, and so like,
shut up.
I'm just trying to figure out today.
Yeah.
Right.
Yeah.
And so like my answer to that eventually, like the way I had to compartmentalize it is here's the truth that I know is that her growth would be stunted without it because she would not survive to be 10.
Absolutely, yeah.
And if she didn't survive to be 10, she wouldn't be having children, And so like we have to take this like really just one step at a time. And so that was really kind of our mantra the first few months is just finding some level of normalcy and peace and figuring our way through that. And I will say one thing about the pediatric cancer community is that while it's devastating and no one wants to be part of it, it is a community of supporting, giving, kind families who
I can only imagine.
Who just try to help you through that. So, whether they've gone through it before or they're currently going, they've gone through it and they have a survivor, they're going through it, they have a warrior, or the worst case scenario, and, they have an angel, what you have is a community of people throughout not just your local area or your state or your country, but throughout the world who really connect and try to help everybody navigate this. So when I say we were trying to find out normalcy, it wasn't, we weren't doing it alone. There are communities, there are nonprofit groups that, for leukemia, there's Leukemia Lymphoma Society. In our local area, there's so many, childhood cancer organizations. One that really supported us was a local organization called One Voice, and they even have events just for siblings.
Oh, wow.
And it's the siblings getting together and the siblings kind of having something special. Because that's the other thing is everybody brings stuff for the child with cancer, and then there can become jealousies because, right, and it's not unusual in the world, in the pediatric cancer world, is that you get siblings wishing that they had, like little kids saying, "I wish I had cancer too," right? Because they just so One Voice really helped us navigate some of those things proactively. And so we weren't doing it alone, I guess. And
to your point, it's one of those experiences where it's a very humbling experience. So if you've already been through that, you can really understand. And other people that don't understand it's sad, because you won't have that experience, and hopefully you don't. But once you do, it's like, wow, I can really feel for all those families out there and donate to causes and be a part of that change. And another thing I learned from what you were just saying, and if anybody listening, if you know somebody that's going through something like this, don't ask all those questions that they don't want to answer. Like, I know you may be curious, but that might be the time you use Google, right? And not put that on a parent that's already going through something at the moment.
Yeah, and another thing, when you Google, make sure it's a appropriate source, right?
Yeah.
Don't share articles about how the parent gave their child cancer because they got vaccines or something. Let's make sure,
a reliable source. Yeah, absolutely.
But good advice. You are really good at picking up on the empath, the empathetic, underlying real solution. So
I appreciate that. I mean, and I feel like it's only human, especially when you start hearing the story, right? Because a lot of people don't take time out of their day to listen to other people like that. It's whenever it's convenient. So I'm happy that I'm able to talk to you about this today. And what was I going to say? Oh, yeah. So moving on. So at what point do you get to the part of the treatment that you realize that there's a problem?
Yeah. How was our treatment disrupted?
Yes.
So here's where kind of the Angels for Change story starts. Like you said at the beginning, I'm, Angels for Change. So in April, the very beginning of April, Abby began a new phase of treatment that's a very rough phase. It's actually called delayed intensification. So what they do is there's intensification, right? There's immediate intense to your body, and then they kind of do 4 months later this 60 days of very intense treatment. And the reason for it is it can zap anything that's left, and and their bodies are building towards this time, or the amount of chemo that they're being given, and they're building towards this time. So this is a tough time, and in this phase, Abby has to have a drug that she had on day 4 of treatment. She had it right away, and she had a reaction to it, but it's a really, really important drug. This drug that she originally had was called PEG asparaginase. And this is something that is unique, kind of unique to pediatric cancer, which also makes them vulnerable to the problem we discovered. In general, the majority of drugs that children take are designed for adults and then diluted for children. So there's not a lot of pediatric specific chemotherapies. There's chemotherapies that were designed. They're tested on adults. They're tested on adult bodies who have already finished growing. Yeah. Right. And then they knock them down to be the appropriate height and weight. So, and of Abby's treatments, of the drugs that she takes, I think in the end it'll be 30 different chemotherapies that she will have taken over almost 2.5 years, in many different ways. So some of them intravenously, some of them through a port, some of them orally, many of them through her spine and what's in a spinal tap. They infuse chemotherapy right into her spine. And so, but the majority of them were created and founded 50 years ago. They're older than I am. Okay. I'm 40. I'm 43. So the majority of her treatment is drugs that were found before I was born. Got it. So they're not new. But this one drug is a targeted drug. It's targeted specifically to leukemia, and it starves leukemia cells. So it's a very important drug, and it's very effective. It increases, in the cancer world, EFS, which is called event-free survival. EFS. That's what we want. Event-free survival, right? What does the event-free mean? No relapse and no death, right? So you're done, it's over with, and that increases those possibilities, right? Yes. Okay. Correct. Yeah. So asparaginase, she had a reaction at day 4, and they were able to pre-medicate her, stop it, medicate her, kind of put her to sleep, and they were able to get her body to accept it because it was so important.
Okay.
So that was very chaotic at that day. It was a very dramatic day, but it happened, and we were like, yay, okay. And the doctor told us, this is so important. We've got to do this. So they hooked her up to heart monitors. They put a pulse ox on her. They wanted to make sure she could get this drug. And then they tested afterwards and made sure that her body did accept it, and they did. So we're going into beginning of April now, and she's in delayed intensification. She needs this drug again, and she's very worried about it. She remembers what it felt like before.
Yep. And
she didn't want to take it. And I was like, the doctor, all the things that they did to get your body to take it after, they're going to do before. This is a pre-medication process. It's going to be okay. So you have to convince her to go in and do this, right? Not scream and yell and comply. There's a lot of stuff around parenting and convincing to comply, using all your parent toolkits. Everything you have as a parent to try to convince them.
Absolutely.
So she does the pre-medication. She has an anaphylactic reaction and is screaming because she can't breathe. And this is another moment that's burned in my mind. Your child in a hospital bed, hooked up to chemotherapy, going into her port inside her body, and her screaming, I can't breathe, help me, mommy. Like, that was a quite traumatic day. And they gave her an EpiPen, they gave her treatment, the nurses were there. They are professional, amazing physicians and doctors
Absolutely.
who took care of everything. But the first thing she said to me was, I told you. I told you this is going to happen.
A little jab in the heart there.
Oh, yeah. I mean, I told you she was a force, right? She's been a force, and you don't mess with her. I told you, Mom. I told you this was going to happen. I'm like, oh, okay. So that they kind of said, okay, you need to go home, and her body needs to rest and recover. We're going to come back on Tuesday. There is one, she can't take pegasparaginase anymore, but there's another drug. It's called Erwinaze, and we give it to patients who have this reaction. It's not the frontline med because they need 6 times the amount of chemo to have the same effectiveness. And but it does work. So you're going to go home, we're going to rest, come back on Tuesday. So we're like, okay. So this is so that was quite an experience. I felt, that there was a lot of recovery for both Abby and I from that experience. But, like I said, we had kind of figured out somehow how to navigate this and talk through it. And
Absolutely.
On the Tuesday, we get in there for the treatment. So at this point, she's already 4 days later than when she was supposed to have this medicine.
Okay.
And remember, way back at the beginning, the compliance, the timing, the protocol, right?
Yep.
They tell us all this. So they say, okay, so we can't give you this medicine today. It's on shortage.
Oh.
And I was like, what?
So the medicine that I need to make sure my child is still getting healthy, there is none.
There is none. So, I immediately go, I'm a business professor, I love free market economics. And,
yeah.
I teach, supply and demand. I teach supply chain management. And so I was like, so I immediately say to the doctor, what do you mean is a shortage? Is it an outage or is it a shortage? And who, when is the distribution going to, I'm starting to ask her questions. And she's like, looking at me like I'm, a little bit insane. And so she was like, we'll just have to wait, and I was like, well, I want Abby to have the frontline care. Like I want her to have frontline care. And she was like, but we're just going to have to wait. And I said to her, okay, I need you to promise me that when they call to tell you they have Erwinaze, that you say it's medically necessary and you're going to give it to her. And she was like, Mrs. Bray, I'm not really sure what you're saying. When who calls? And I was like, well, I don't know yet. I just found out this was a problem. But I need you to promise me that whenever somebody calls, because we found it, that you're going to give it to Abby and say it's medically necessary. And she was like, yes, if someone calls me, like she was kind of,
okay,
yeah.
okay, absolutely. I could see that conversation happening. Yeah.
And she was like, I really wish I could relieve your anxiety about this. And I was like, oh no, this isn't anxiety. This is problem solving.
Yeah.
We got and she was like, okay. So that's the day that I learned something that I had no clue existed in our country. I mean, I literally thought, so I joke, and I mean, I don't joke, but I say, I didn't know anything about pediatric cancer, but I knew that pediatric cancer existed, right?
Yeah.
I just didn't really understand what it meant. But this day is the day that I learned, this was now April 2019, that you could do everything correct. You could literally help your child through the hardest time, get them to comply using whatever tools necessary. You could have a job. You could have insurance. You could have a doctor ready to treat them. You could have something, a doctor, life-saving condition.
Yep.
And it still didn't matter. Your child may not get access to the drugs they needed to survive. And I just didn't understand it. It didn't make sense to me.
It's hard. I mean, it would piss me off so much. It'd be hard to not misdirect anger towards the doctors, which I'm sure you didn't. I would do my best not to as well. But I just, even just thinking about it right now, even though you're working on the solution right now, right? That how do you not have it, right? How do you not have something? And I'm sure you're going to get to this in a minute, but how do you not have something that saves people's lives, that's necessary, that people need? It's not that it's like, oh, if we make it, people aren't going to buy it. You know what I mean? Like, it's going to be you. Like, how does that not, it just doesn't make any sense.
Well, it didn't make any sense to me either. And I kept asking all of those questions and more. So you're right. You're right on target. That's exactly, I was like, this doesn't compute to me. Yeah. If I wanted to right now with my phone, while we're having this conversation, I might be a little distracted, but I could decide that I wanted to buy a pair of shoes in Australia.
Yeah.
And if I was willing to pay enough for them, they could be on my doorstep tomorrow.
Yeah, absolutely.
From my phone. So I kept saying, I just don't understand what's happening.
How much time that night did you spend on Google? How much time that night? Because that's all I could think about.
Say for the first, spoiler alert, we were able to resolve Abby's shortage, but I'll go back, it took about 10 days from that moment, the day that I found out that this was a problem, to 10 days later, she was receiving treatment.
Oh my God.
But yeah, I mean, the first thing I did is I had a few pharmacist friends that are pharmacists, including my sister-in-law. And I just literally, before I left the hospital, I sent a group text that said, Abby needs Erwinaze. I need to know everything you know about it, and I need to know how I go about getting it. Because I thought, well, they probably have access to databases that I don't have. So
Absolutely.
That was literally the first thing I did. So I right away found out from, it was 6 different pharmacist friends that work at various different pharmacies. There is none of this. It's not something, it's a specialty product, and it has been on shortage for a long time. So that was the first, okay, so this is a real and a systemic problem. All right, it's not just enough of me, tracking it down from a different pharmacy.
Yeah.
And the next thing I did was I searched on Google, like you said, and I found an article about a mom who had this happen to their child. And I read that article, and here's another, miraculous moment. I was connected to this person via Facebook. So my friend, who I know, was friends with this person. And so I read that article. I was like, my first thought was, okay, I read this article. There was two things from it. One, it's possible. My doctor had said it's not possible. We just had to wait. But this person did this, had this happen, and she resolved it for her child. So first, it was validation that it was possible. I didn't know how, but it was possible. And then two, it had happened more than 3 years before. And so the second realization is like, what is going on in the marketplace that this pediatric cancer drug is still on shortage after 3 years?
It doesn't make
sense. I'm just not, how does it not get resolved? In supply and demand, and usually when there's a shortage, the market reacts and they do something. What do? They
make more.
Increase supply, right, to meet demand. Yeah. And price may go up, but that's okay, right? That's how it kind of stabilizes.
Exactly.
And so this wasn't happening. And in fact, the second thing I found was a thing that said that in the pediatric shortage marketplace, the opposite is happening. When there's a shortage, supply is decreasing on average by 20%. And this confused me greatly. So we'll pause on that statistic because when I got into Angels for Change, I was kind of a little bit obsessed trying to figure out that. Something is working against the theory of supply and demand. This means that there's active things in place that are keeping the market from working in the worst case scenario, in life-saving treatment.
Exactly.
So, yeah, but here we are. It's April. I have to figure out how to do this. What I started doing was basically calling everybody in the supply chain. I understood enough about supply chain to know that just because this drug is made by one place, it doesn't mean that's the only place that there is access to it, right?
Yes, exactly.
Maybe the distributor has it. Maybe other hospitals have it. And so it was that I began getting some action. So I actually got the distributor of the drug was a company called McKesson Corporation. Mm-hmm. McKesson Corporation is one of the largest companies in the world. And I literally started with every single one of these scenarios. I started with the 800 number that is posted on their website. No additional insight. I don't have money. I don't have power. I don't have connections.
Absolutely.
With every single one of these scenarios, I looked up, okay, the distributor is McKesson. I found this on Google. What is their phone number? How do I get it? Right. So I began making calls and just asking, this is happening to my child. Do you have children? Basically explaining what's happening. Will you help me? Will you help me figure out who in your organization can help me? Yeah. And then just kept, well, what about this person? And then I tell my story. And so there was just a lot of that happening. And so at McKesson, I finally got to someone who said, okay, yeah, I actually got to the department that distributes this drug.
Okay.
And, in a global organization, I made it to the people who actually do
they have their hands on it, right? They have their hands on it, essentially.
Yeah. So what they say is we don't have any. It has all been distributed. But listen, if you can find it, what we can do is distribute it. So we will figure out how to get it to your daughter. And so the next question is, okay, so you don't have any more. The manufacturer, they say they don't have any more. Where and who did you distribute it to so that I can call them? And
they're like, that list? Yeah.
Right. Yeah. Can I get that list? And the answer was I'm sorry, contractually, we can't give you the list of our customers and because it had been on shortage for so long, there was HIPAA issues because the only people who could order it were patients who were in need of it. So the ordering process was patient specific at a hospital.
Oh,
so they're
okay.
so they're like, sorry, we can't do that. And so I was like, okay, but it has been distributed to individual pediatric hospitals in this nation. Yes. I was like, all right, well,
top list of top pediatric hospitals in the U.S. Yeah.
You are so right, Victor. That's what I did. I Googled U.S. pediatric hospitals and downloaded a list and made a spreadsheet. And I had a hypothesis here, and it wasn't to go to the biggest hospitals. It was actually to go to the smallest hospitals. So I had this hypothesis that the biggest hospitals have the money to buy this very expensive drug and maybe to have extra, movement, not necessarily worry about this expensive drug if there's no person who needs it right now. They'll hold it until they have the next person. But there might be smaller hospitals who had patients, than what is said, removed from the protocol. But that's business or medical terminology.
Gotcha.
Oh, someone is removed from the protocol because they can no longer take that medicine because they did not have a better EFS, event-free survival.
Yes.
So I was like, there might be a smaller hospital that has some on their shelf with no one allocated to it any longer, and they may be willing to give that up, right? That might be something they're willing to not give up. That makes
sense. Yeah. They're willing to give it to somebody that needs it.
Yeah. So I downloaded this list and I basically made a little spreadsheet. I was like, I used to help, make call centers, when I was consulting, kind of walking through that scenario. I can make a call center. I have a lot of friends. So that's what I did. I pushed out. It was Saturday. So we found out about it on Tuesday afternoon. On Saturday, I pushed out this list and said to my friends, okay, there's over 1,000 hospitals on this, numbers on this. There's 250 of us. If everyone on here makes 4 calls, we could be done with this in an hour. And Abby needs this. Will you help? Right? And so it was a Saturday morning, and in 2 hours later, the list was gone through, and we had found the Erwinaze that she needed.
Oh my gosh, that's something out of a movie. That's 10-day turnaround for something that the doctor said it doesn't exist.
Yeah, so at this point, it was only 5 days, less than 5 days, right? 5 days, yeah.
10 days to actually get it distributed over.
Now we had to figure out, we found it. I found it at a hospital. All I have at this point is I found it at a hospital who said that they would be willing to distribute, release it. But all kinds of contracts have to be made. Payment has to be made. My insurance company has to be involved and say that they, will make sure that payment is made. And then I got to call this, large global organization who made this promise to me. They may have made this promise thinking, we'll never hear from this person again, right?
Yep.
And say, okay, good news.
So
I found it.
How do you coordinate? Did you do like a big conference call? Did you have a bunch of different little calls with each person?
Yep. Or bunch of little calls, lots and lots of little calls, and every one of them had their own unique opportunities to solve or problems that we had to overcome or objections, and I just handled them one at a time in the same way that I would teach my students, right? Okay, you've got a problem. There are many pathways to success. How are you going to travel those pathways? So by Monday afternoon, we had a contract in place with both hospitals that, and McKesson was involved. And then there was a need to do the whole, it couldn't go straight from the hospital to my hospital. It had to go back to a distribution center where they had to open it up, make sure that it was still good, right? I mean, it had to travel, it had to be packaged correct. Is this chemotherapy still effective? Has it been, held at the correct temperature? It's a very, very complicated and very important drug. So complicated to make. And, so it had to go from New Orleans to a distribution center in DC. It had to be opened up, tested, repackaged, and then sent to my hospital. And so that happened by Wednesday.
Wow.
So that was 8 days from the day we found out that there was a problem to it being in our hospital, and then the treatment began on Friday.
What did your doctor say when you were like, I got it, right?
Well, she thought I was a little, insane, I think. But when I mentioned that I found the one mom that was the Wednesday after, I found that I found Googled that and found the mom, and then I was able to talk to that mom. The first thing she said to me is, okay, first thing she said was, "Oh my gosh, this is still happening." She was blindsided. She had no idea this was still happening. And that haunted me, because that meant that even when I was convinced, when I help Abby, it wouldn't be resolved. No matter what I did to help Abby, it didn't fix it, right? Because she was under the impression, after she had resolved it for her daughter, that it would fix, right? And so her first statement was...
I get what you're saying.
Yeah, her first statement was like, that's still going on. Oh my gosh. And then the second thing she said is, "Laura, I have to ask you a serious question, but it may sound silly. My question is, are you willing to get a little crazy for your child?" And she was like, "Because I have to tell you, for about 2 weeks, I was a little crazy. And if you're not willing to do that, this is going to be really hard." And so I was like, well, I can get crazy,
For my child, absolutely.
Yeah. And so what did my doctor think? My doctor thought I was a little crazy. But then they couldn't believe it. They were like, whoa, this is insane. The other thing that I think they did have some ethical concerns about it. And the ethical concerns are that there were other patients at the hospital who were in need of this drug. And they were treating one, but not treating all.
That it was on their mind, like,
yeah, for sure.
Yeah, and
it's easier to say everyone's on hold than one person.
Yeah, well, imagine that conversation now that they're going to have if somebody comes up to them. It's like,
Terrible.
Hey, they got that drug. Why isn't my kid? Right.
Yeah. So my answer to them was, have them call me. I'll try to see if I can find it for them. My answer was, please don't make my child, we found this. Don't make my child suffer because you don't have enough for everyone.
Yeah.
Please treat my child and then let's figure out how to help others. It doesn't have to be that way. It doesn't have to be one or the other. We don't have to
play favorites. Exactly.
Right. Let's figure it out. Which again, they thought was insane, right, to be saying, because this was a systemic long-term problem.
So at what point did you start creating the organization Angels of Change?
So Angels for Change,
my apologies.
Angels for Change, yeah. So the name is really unique. It came because on the day Abby was diagnosed, our friends created a Facebook page for us that was private, and they called it Abby's Angels. And it was those angels that I pushed the list out to.
Oh, they're the ones that made the calls.
They're the ones that made that call. And their little bit of effort on a Saturday morning made the change that Abby needed to keep moving forward with treatment. So that's kind of where the name's Angels for Change. So, and then I became Chief Change Maker.
Yeah, I saw that on the site.
So, add that to, Caretaker in Chief and Chief Normalcy Officer. Let's add, Chief Change Maker to it. So, within about a month, I was still doing a lot of Googling and trying to figure out I don't understand how the systemic problem is. And in my mind, honestly, Victor, I thought, I'm going to find the organization that's already working on this. And I need to figure out who that is. And then I'm going to kind of figure out who that is. And then I'm going to just give them a call and tell them about our story. And then, that's how I'm going to help, right?
Yeah. Easy. Just going to find the highest guy up there, the one that, runs the whole thing.
Whoever's already doing this, I'm just going to find them. And because, I wasn't really thinking I was in a place, I work, my husband works, we're a normal family, not independent, wealthy. No one knows who I am. I'm not a celebrity.
Yeah.
I don't, I've got 3 kids. One of them has cancer. I wasn't really thinking I would be starting a nonprofit organization during this time. But I kept looking and trying to find who it would be that I could figure out how to help. And in the meantime, a couple of families found us. I didn't take this public. I didn't have articles written about it. I really worked with my knowledge of the supply chain and worked with problem-solving individual, individual objections. So, and so I was trying to share, like, here's what I did, and here's what I would do, and here's what I would do next. And so that was kind of happening on its own. And I'm not entirely sure how I was found always, but, you know, if somebody called me, I helped them. And then just like we were calling 800 numbers and we found people willing to help us, I sent an email to the FDA. There was a drug shortages task force. And again, from a public email address. I didn't have any real connection, and just kind of shared my story and said, this happened to us. And I found your group, and you seem to be working on this, and I wanted to know if I could help, or if sharing our story, you know, would you be willing to meet with me in person to share our story? Yeah. I figured, you know, I always ask a little bit bigger, right? Mm-hmm. If I said, will you meet with me in person? And the answer is no, but I'll give you a call, right?
Yeah, yeah. That's smart.
So I threw that out there. Will you meet with me in person? And someone read it, someone responded and said yes. And that someone was the chief of staff of the FDA.
Oh my gosh. Talk about going to the top.
Well, I didn't really know I was doing that at the time. But again, this is a serendipitous moment. There's nothing that I didn't really do anything. I mean, there's no way I didn't do that. I just sent an email, right?
Yeah. Something happened behind the scenes.
there was more, you know, help at work. And so I said to myself, if you've got a meeting with the chief of staff of the FDA, you're not going just as Abby's mom. You got to go as an advocate working for an organization, because I got to go as someone who isn't just sharing a story.
Yeah.
I got to go as someone who wants to help others,
yeah.
right? Or who, yeah. And so I literally created a website and a brand and a business card, embroidered some shirts, and made a brochure, and flew to DC.
That's crazy. And just like that, you were legit.
Well, so I mean, I did pull together some of my lovely angels, some of Abby's angels, my friends who were unbelievable business people, and just said, this thing is happening, and I feel like I'm being called to help more people. And, you know, at the very least, I want to put a website up so that no one is going through it alone like I did, right? Not knowing where to start.
They can search those keywords, you know, that you needed at that time that you couldn't find, right?
Correct. And they can call me. I'll pay for a phone number. I'll pay for a website, so that no parent is flying solo on this again. That was the most hopeless I think I've ever been in my life, Victor. You know, you would think your child being diagnosed with cancer was the most hopeless, but actually knowing that my child had cancer and was fighting for their life, and not knowing how they were going to get the drugs that they needed to survive, how, like, I'm her caretaker.
Yeah.
I'm the one who needs to help her through this, and how am I going to do that? So I thought, at the very least, I have a website so that nobody goes through that alone. And that's kind of how we started Angels for Change. That meeting was really great. It was really a fantastic meeting of wonderful people who did not push back at all. All of them said, yes, this is a terrible problem, and here's what we're trying to do, and here's how you could help. And I said, okay, done, I'll help. So that's kind of what happened. I then, went about creating a 501c3, and shortly after that meeting, there was a crisis in pediatric cancer, and it was a shortage crisis, and it was called the vincristine crisis. This was now October 2019. And once again, Abby was put on hold because she needed a life-saving chemotherapy to save her life that was in shortage. But this time, I was chief changemaker, founder of Angels for Change.
You were prepared.
Yeah. And so I was able to help her and help our hospital a little bit. And I was able to help parents who found us and reached out. And then you wouldn't believe it, but in January of 2020, Abby faced another drug shortage. 3 drug shortages. I know.
What I think about is you were able to fill a need, right? You were able to solve this need, and in the most direct way for your daughter, right? Mm-hmm. You were able to fill this need, and now you know how to. But there's people out there that are going through this that think there is no a way to go around it, right? Yep. Like, we're just going to have to wait. And if this happens time and time again, there's that EFS, right? That's not going to happen, right?
Yeah. So, I mean, there is data that shows specifically that, compliance lowers EFS. There's data that shows specifically that that the not having Erwinase, or asparaginase lowers EFS. So, this is serious. And I do believe, it is a right to have access to life-saving drugs. If there is medical technology research that births life-saving treatment, it's proven technology, it's a right for your child, for any patient to have access to it.
Absolutely.
And the reality is a doctor who is in the throes of fighting and saving lives every day, resolving a shortage should not be their job. Also, having that conversation that says there is no drug should not be their job. Mm-hmm. But do you know what the conversations they have to have sometimes? They actually have to have conversations with families saying, the 3 of you need it. We only have one, enough for one. This person's going to get it. I'm sorry.
Oh, my God. Oh, that's heartbreaking. I can't even, there's no way for me to process that because I would never, I'm not in that situation, right? So yeah. That's just so heartbreaking. That's so heartbreaking.
It is heartbreaking. And, it's a heartbreaking thing to throw on families who are already in survival mode.
Yeah.
It's pretty, if you do any research in pediatric cancer, that in general, I think 80%, families end up in divorce post a pediatric cancer diagnosis. You talk about monetary, like almost everyone loses a job of some sort, loses mm-hmm. monetary income. Of course, their costs are increasing, right?
Yeah.
Just in additional insurance costs, but, and deductibles and such, but also you need new things that you never knew you had needed before, right? Yes. So, these families with any family with a cancer diagnosis is in survival mode. Pediatric cancer really puts tremendous strains and stress on the family unit, and it's a terrible place to be putting parents in during this time. So that's what we're fighting for.
Absolutely.
We believe our purpose is to ensure access to life-saving drugs that no patient or family should hear we don't have the drugs to save your life, and no doctor should be in a place of ever saying those words. It really is unfathomable. So what we're doing, or what I'm doing now, is when families call, we're helping them resolve the shortage is the best way that we can. And I'm very thankful that we're not doing it alone. We have met many angels along the way. One of our large partners is McKesson Corporation, that distributor who said, yes, they would help us when we were searching for Abby. They now have a team of professionals who help if there's a shortage and we're able to call. And we're working on creating more relationships like that because it can't be done on your own. It has to be done with a lot of help and support. And then we've been able to help 30 patients, all children, resolve a shortage since October 2019.
Well, yeah, it's only been a short amount of time now. You guys just started essentially, so that's a lot. That's a lot in that amount of time.
Yeah. Yeah.
So
And those are just people who find us. I am haunted at night. The reality is the more sick or the more in survival someone is, the less likely they are to search a website and find us, right? I can only help families who contact us, right? And I'm only just one person. This was completely self-funded. This is us. We're funding this ourselves. But I couldn't sleep at night knowing that there are families in the situation. And I don't know that I can resolve every single shortage that comes our way, but I can guarantee that someone won't go through it alone. And I know what it feels like. So I'm able to cry with these patients, with the families, in the way that someone else who hasn't been through it, really can't. So,
well, you guys are definitely angels, and I thank you for being on the podcast and sharing that and sharing what you guys are doing, because so many things that are happening in this world right now that it's good to shine light on people that are doing good, and I think it's important. What's the website? So if people want to go get information, or if they want to donate,
Sure.
which would be great,
Sure.
What's the name of your website?
It's angelsforchange.org, and our Facebook is Angels for Change, and we're trying to help one patient at a time, as they call us, but we're also working to try to fix some of the systemic problems all the way up in the supply chain, so that it never actually hits a patient, so that a patient never actually has to hear those words. So we'll be here to help with both the reactive advocacy, one patient at a time, and also looking at the complete supply chain, and why is it that that a life-saving drug doesn't have access? We don't always have access to life-saving drugs when we need them. And why is it that the marketplace is reacting in an opposite manner when something is on shortage? Why does it decrease the shortage, decrease the supply instead of increase the supply? So we're working with experts much smarter than me, really just trying to, I'm trying to be a catalyst and helping everybody remember we've all got family members. We've all, we all have children that we love. We can all understand that the statement that my doctors had to give me, saying there wasn't any, we had to wait, is unacceptable. But also, Abby asked me when she heard that, she asked me. She's this force. She got right to it. She understood. She's like, Mom, am I going to die because I don't get my medicine? And that's an unfathomable question for a 9-year-old to ask, and it's really unfair that I had to answer it.
Yeah, nobody should ever be put in that position, especially like you said. And it just doesn't. If it's out there, it should be made and available for people. I mean, it's hopefully with you guys can come up and figure out how to stop that from happening.
Well, we're launching our first summit with the pharmaceutical supply chain on October 30th.
Oh.
And it is specifically looking at that. What's one thing, two things, three things we can do that will decrease systemic shortages? And we're really excited to begin being a catalyst and a helper, using our story and looking at long-term solutions.
Well, Laura, I bet you never guessed or would have ever fathomed that you would be creating an organization. But
No.
Things happen, for a reason, and I appreciate you for taking it on and
Thank you.
Helping other families and continuing to help families to solve this problem. And I appreciate you sharing your story today with us.
Thank you for inviting me, and thank you for asking us to share our story. And we are always looking for change makers. So if anybody wants to be a change maker, we need as much help as we can get.
Angelsforchange.org. Get more information, guys, and please donate to the cause. It'll be one of the best feelings you'll ever have. Thank you, Laura. I appreciate your time, and we'll stay in touch, okay?
Thank you, Victor.
Thank you, guys, for listening to that. I really enjoyed that conversation. I learned a lot. I could feel, literally, my hairs are standing up in some of the things that she was saying because it was so sad at times. But I feel like that conversation was needed. And if you know anybody that's going through something like that, please let them know about this organization, Angels for Change. It can really, really help them out. A problem that I didn't even know we had. But anyway, please share this. You can listen to this anywhere you listen to podcasts, Google Play, Spotify, Stitcher. And you can always go to www.cococalientepodcast.com. You can check us out there. Don't forget to follow us on Twitter @CocoCalientePod and on Instagram @CocoCalientePodcast. Bye-bye.